Good evening, everybody. I am Dr. Panir Selvam, Chairman, CII-Erode Zone. I'm very happy to welcome you all to this webinar on digitizing smaller hospitals, the way forward. It's a really overwhelming response from all the participants. We are happy to host you here. India is going to be a digital world, and digitization is not for comfort or sophistication. It is a basic necessity. We have to think and act digitally. But as healthcare providers, are we ready? What is the where do we stand? Though as healthcare professional for patient management, we have adopted technology, but practice management is still a long way to go. We have to improve a lot. So, see, the purpose of CII is to encourage the smaller hospital, which forms 80% of the healthcare in India, to adopt digital practices so that they can be more efficient and more productive. So the purpose of this is to help you adapt the change. For that, we have three eminent speakers to speak to us today. Mr.U.K.Ananthapadhmanabhan, former Senior Vice President, KMC, Coimbatore Medical Center and Hospital. Mr.R.D.Thulasi Raj, world-renowned community ophthalmology expert and founder member of Aravind Eye Care System, Madurai, and a busy financial consultant from Chennai, Mr. Siva Ramakrishnan. So initially the presenters will be presenting that. After that, we will have the question and answer session where participants can post their questions. Over to you, Sendil, for further. Thank you. Dr. Sendil.
Thank you, sir. I thank CII-Erode for taking this wonderful initiative. The concept of digitizing hospitals is quite interesting, and not many organizations have thought about the digitization of a small healthcare organization. Basically, because even from the doctor's viewpoint, we don't have the think about the importance of digitizing the hospital. Because we are, as doctors, the problem we have is we are ready to invest for equipments, and we don't look at the software or a digital medium as kind of an investment into the hospital. In fact, it was very surprising 4 or 5 years back when I was in a digital healthcare meeting. We asked the corporate hospitals what is the budget they have for digitization. So most of them said somebody building a hospital for even 10 crores, they were not having a budget of for the digital media or software for more than 50,000 rupees or 2-3 lakh rupees. So there is a lot of lack of awareness among doctors about making up some investments into the digital part for the hospital. With the COVID situation, I think we are all feeling what is the importance we need for the making of the investments into the IT systems. Another common misconceptions we as doctors have is basically we think it is only for the corporate hospitals. So as a small healthcare provider, I don't need to have software. So basically, I feel we have to change the mindset. The whole idea of this webinar is to focus on digitization of hospitals. And this conception we need to take away from mind is the digitization is not only for corporate hospital, even a small healthcare provider has to digitize his practice, because the time has come now for that. Second part is the digitization is not expensive, so it is definitely worth the investment. So that's,
yeah, sorry.
So you can continue the presentation.
Yeah, thank you. So, sorry for the technical glitch. Maybe I will just take a few minutes. There are a lot of emerging and innovative technologies like IoT, 3D technology, artificial intelligence, big data, genomics, edge computing, machine learning. There are so many technologies, but today I thought I will tell you something about IoT, maybe a little bit on artificial intelligence, internet, real-time location tracking, BLE, and all that, which are very, very useful. Sendil, are you here now? Hello? Hello? Yeah. Sendil, am I audible? Am I audible? Hello?
Yes, sir, you can continue. You are audible. Please continue.
Yeah, so I think here we should recall and remember a few of the words of wisdom from many of the management experts and industry experts. Anything that cannot be measured cannot be controlled. Now the organizations expect not 30% productivity, but they expect about 3,000% productivity improvement. And in the past, we put technology into work, and now we are trying to put work into technology. That's what Chandrasekhar of TCS said that. So Mrs. Preetha Reddy of Apollo Hospital very nicely put it. You cannot reduce doctors, you cannot reduce consumables, but you cannot reduce technicians, but you can definitely reduce a lot of waste that is happening in the hospital. So having understood this, I thought I will quickly take you to what is the definition of smart hospital. Smart hospital is one just to be optimized and automated in its process in an ICT environment, interconnected assets, using Internet of Things to improve the existing patient care and introduce new capabilities. So what are the characteristics of a smart hospital? The characteristics of the small hospital is they are all digitally transformed hospitals from end to end. You know, you must have very good IT hardware, you must have software, the network, and it must be completely connected hospital with sensors, gateways, devices, applications with IoT and cloud. And the hospital operations have to be completely automated, whether they are air conditioners or lights or pumps, everything should be able to be scheduled for switching on and switching off. And even in materials management, we could use this technology where you could use technologies like RPA to do auto GRNs, purchase orders, and maybe even three-way matching of bills through electronic data exchange. And then you must be also able to real-time monitor 24/7 all the parameters, maybe energy or water, or maybe even the location of the equipments. They must be ubiquitous. That is, you should be able to monitor anything from anywhere, from any place. So, and it should also have some of the interesting, important things like your dashboards. Dashboards are very important, and AL and ML for decision support. When you're talking about AL, we are talking about, in AI, you're talking about artificial intelligence and machine learning, and which are very useful for decision support. And this should have minimum human interaction in the hospital operation. These are all the very important characteristics of the hospital. So what are all the challenges in the hospital right now? The rising cost of operations, manual data capture, risk to patient and caregiver safety, and no revenue optimization. When you're talking about rising costs of operations, you have lack of automation, wastage of consumables, escalating water and energy costs, long waiting times and turnaround times. When you're talking about manual data capture, 40% of the nurses' time is spent only by nurses and technicians spend their time only on recording, monitoring the data that they capture from patients, maybe from the equipments. That is also a sheer waste of effort. And the rest is there is no revenue optimization. You have missed billing, manipulation of data due to manual processes, revenue leakages due to missed manual entries of asset usage and equipment. Risk to if you see the risk to you have exposure of patients and staff to radiation and heat, infection, and in ICU, CSSD, CT scan, and poor monitoring of even temperature and humidity in critical areas like operation theaters, ICUs, and laboratories. As per the norms of one second, I'm just trying to close. Okay. So what are the IT, IoT enabled solutions in a smart hospital? We have asset management system, a building management system, real-time location tracking system. In asset management system, you have a lot of modules, and those modules help you to monitor 24/7 the tracking of medical asset performance, utilization, revenue, inventory, annual maintenance costs, and improve the hospital revenue and clinical outcomes. And when you are talking about IoT-enabled building management systems, you have automated monitoring of measurement and management of water, energy, temperature, humidity, environment, save on manpower, materials, and energy costs, and ensure efficiency is there. Then we have real-time location tracking systems. And of course, I'm not going to talk much about the real-time location tracking systems because it may be a little out of scope for small hospitals. The real-time location tracking is a very emerging technology where you can locate any equipment, any patient, any employee, so that you can locate the misplaced equipments, even the loss of costly equipment, and improve the workflows, improve the workflows in the hospital. So what are the assets you can monitor in the hospital? You can monitor infusion pumps, cardiac monitors, maybe ventilators. You can have mobile devices like tablets, mobile laptops. Then you can also connect. You can also connect many of these third-party applications like hospital information system, laboratory system, radiology information system, PACS, and so many things are interconnected. And this only makes it a smart hospital. So what are the small hospital infrastructure? When you're talking about hospital infrastructure, I just took an example of a small hospital, 100-bed, beautiful cardiac center, especially in the Tier 2 city where I work. And here you see most of it is all automated. See, you may be wondering why I'm showing this corridor. In this corridor, if you see, there is a nurse station, and you have about 25 patient rooms, which is almost about 150 feet away. So if a nurse has to go to the last room and come back to answer a nurse's call, or to check whether a drip is over, she will be going at least 10 or 15 times in a day, and it is a sheer waste of time and effort. Now there are wireless LoRa-enabled nurse call systems and drip monitoring system which we can use, which are very, very cost effective, very simple to implement. I'm going to show some of them. And you must also see this is a substation of a 100-bedded hospital where you have all the energy meters connected through IoT system, and we should be able to monitor the power that is consumed in light and power that is consumed for medical equipment, utilities, and also monitor the power quality of the hospital. And you can also switch on, switch off, automate the air conditioners, AHUs, then maybe AC plants which are air cooled or water cooled. I just showed these just to make you understand what are all the infrastructure facilities that can be IoT enabled. But now let us come to very quickly, what are all the modules in this IoT enabled building management system, asset management system, and real-time location tracking system, which can be used in the small hospital. You can use IoT enabled energy monitoring system, power quality management system, UPS monitoring, ambient and temperature and humidity and pressure monitoring, refrigeration and cold storage equipment, temperature monitoring, water supply and consumption. You can also use for ambulance tracking and tracing, wireless drip monitoring system, wireless. Give me 1 minute. A wireless drip monitoring system, wireless nurse call system, and wireless people counter in the hospital where some people go into the say dining area or a restroom, we can count the number of people so that you can improve the cleaning and service in those places. And asset management software. These are all the various modules that can be enabled through the IoT system. I'm going to show you some showcase some of them in the present demo. These are all some of the screenshots of a real-time IoT system in a hospital. This is the maybe the opening screen of the system. And in this IoT system, you can monitor real-time data, you can get historical data, you can get trend charts, you can time frame comparisons, you can get minimum and maximum and average values. And this IoT-enabled system is much simpler to implement. It is much more cost-effective, and it is you get analytics out of this IoT system. When you are talking about real-time data, you will be able to see the actual energy that is consumed at that particular point of time. You will be able to see the voltage or current at that particular point of time. You will also be able to show the historical data. What was the power that was consumed yesterday? What was the power that was consumed 1 month back? You are able to show the historical data. You can also show trend data. Trend data means maybe between 12 hours time period, what was the voltage that was maintained? What was the temperature that was maintained? If you want to show to any of the regulatory authorities, or you want to show to your service agent who says that the equipment failed because there was a surge in your voltage at about 12 o'clock in the night, you will be able to prove to him that it was not a voltage surge. Please see the voltage was exactly 220 volts as you required. So the time frame comparison again is very, very interesting. you can compare the voltage or a current or temperature or BP, whatever it is from what was last week was this week, what was yesterday was today, what was last month was this month, like you do it in the financial statements. So then we can also see maximum and minimum values. You can where you require this, because we want to know in the operation theater what was the minimum temperature that was maintained and what was the maximum temperature that was maintained. Maybe in the refrigerator, what was the minimum temperature that was maintained, maximum temperature that was maintained, and we want to know how much was the maximum energy consumed in a particular period of time, what is the minimum energy consumed, all that we will be able to see. This is again, this is the real screenshot of a screen where you can monitor energy, where you will find you have a Tenxhealth daycare center DG supply, you have Tenxhealth daycare dialysis center, and you have EB supply. You are able to see all the parameters for today, yesterday, last 7 days, this month. You are able to see these are all real-time data. It was just captured about 4 days ago. And you are also able to see the latest metric values of all the 3 supplies. You want to see the kilowatt, you want to see the RYB, what was the current red, Y phase and blue phase, what was the current, what was the voltage, you will be able to see. Here you are able to see the temperature of room temperature. This is again very important for NABH and also patient comfort and also for energy saving in very important areas like ICUs, operation theaters, laboratories. You want to maintain a particular temperature and humidity based on the patient comfort and also safety and also NABH regulations. You will be able to monitor, and you're also able to see the trend below. So you will be able to know what was the temperature at about 12 o'clock in the night. Maybe at ICU, doctor comes for ICU rounds and the patient complains that at 12 o'clock I was shivering. So he can always go and find out the temperature was really 18 degrees and these people did not maintain proper temperature. So this is again, this is the actual reading for a OT fridge. You know, in the OT fridge, it was minus 20 degrees. It's okay in the freezer, but we know, but in the other fridges, the temperature was this much. That is an indication that the power supply was gone, or maybe the refrigerator did not function. So this have never been identified in a hospital with about 20 fridges that are operating in different places of the hospital, and you can also see the trend values there. This is the water level. So you can also monitor the water level, syntax tank, cement tank. We have some for the small hospital. Then we may have a syntax tank for dialysis unit one. We may have some cement tank for drinking water facility. We can see what was the percentage of level, and we can also set the lower threshold and higher threshold. Once I set the lower threshold and higher threshold values, automatically the pump will switch on and switch off based on those threshold values. And so you don't require a plumber, we don't require a technician to do this. And you will also be able to see the level of water levels and trend. And this is the time comparison. This is the time comparison. You want to compare water consumption. Water level is different and water consumption is different. In the water consumption, you will see that what was the water that was consumed this hour, today, this week, and this month. I can tell you, ladies and gentlemen, if you wanted to capture all this data and do it through Excel sheet, I don't think anybody can do it ever in this hospital. Even in big hospitals, they cannot do it. And so here you see even solar energy. Now we have a lot of renewable energies being used in the hospitals. Maybe many have even wind turbines located outside. Here in some hospitals, we have solar panels where we generate a small amount of energy and even feed it to the grid. So you can also find out how much energy was generated and given into the grid. We can see how much energy was used. We can see how much energy was generated and given to the grid. So this is again a very interesting module. This is the UPS. You know, we have costly like ventilators, monitors, infusion hospital, and we want to find out whether the UPS is functioning correctly, whether the UPS is overloaded or there is high voltage that is coming into the UPS. And in our hospitals, usually we have about 4 UPS, maybe 2 UPS are dedicated for medical equipment, 2 UPS dedicated for IT equipment. And so you will be able to know whether the equipment is overloaded. So you will I'm able to see that this particular UPS, the phase 1 is loaded to about 68%, and the other one is loaded to about 69%. So this is very, very interesting. This is about the medical equipment. See, in our hospitals, we have costly medical equipment like ventilators, monitors, infusion pumps, and syringe pumps. We may have about 100 monitors in the hospital. We will have about 25 ventilators in the hospital. We will have about 150 to 200 infusion pumps. They are very expensive. We invest almost about 20 to 30% of our cost, by our investment in ICUs, and we want to know whether they are working, and if they are working, how much utilization was done, how much it earned. We want to see all this. So I just put an IoT device on each of the equipment, and I'm able to get that data from the inside the equipment into my IoT platform, and from the IoT platform I integrate it to my HIS system. So this is a very, now what you are seeing is a ventilator. So we can say that if you see 10, that means it is working. Just imagine if a biomedical engineer or a COO can have a visibility of about 100 monitors, 150 infusion pumps, and about 25 ventilators sitting on a table like this, just like that. I think it is really a great advantage to the hospital. This is again a very interesting application, and this nowadays in most of the hospitals we have ambulances, we have buses, we have vans to take the patients to the camps, bring them back, ambulances to take them from the hospital to the room, from the houses to the hospital. And in some hospitals we have almost about 15 or 20 such vehicles, and now diesel is very expensive, and we want to know how much was the distance travel, how much you should charge the patient, whether the ambulance is going in the right route, whether the driver is following the right route, whether he is taking the shortest route. We'll be able to see, and I will be able to give you a rundown summary of each driver, each vehicle. Suppose if I have 15 vehicles at the end of the day for a particular time period, I'll be able to give you this. So you don't have the drivers pleasing the patients. You are able to pay for how much diesel you have to really put. All the detail you can seeing this. This is a very interesting application. And this is a very new innovative application using LoRa. LoRa is a new wireless technology like Wi-Fi. And this is the drip rate now. I think all of us must buy this. This is I have seen myself whenever many of our relatives or friends get admitted in the hospital, there will be a IV fluid that will be going in, and the nurse will keep on telling us, if the IV fluid is going down, please come and let me know. So for all you know, the nurses and the patient relatives will forget, and towards the last they will come up to the ward station and say, okay, the IV fluid is getting exhausted, please come and replace it. So you can see this here. This is by Zoho, and this is by a company called Eve Labs. I think it is a startup company, and you can remotely monitor all the IV fluids into this tablet. Just imagine if there are about 100 IV, and this cost is not much. It costs only about 10,000 rupees or so, and once you do it, it's a permanent fixture in the room, and you will be able to monitor hundreds of patients over a period of time. And you can do a lot of analysis out of this. How much fluid was given, when was it given, whether the nurse gave it in time, all that we'll be able to see. And you will be able to do reliable drop sensing, monitor IV closely, remote monitoring of emergency alerts, reduce nursing working load, improves patient safety, audit reporting, and it is affordable. And this is again a very interesting nurse call system. Even small hospitals can use it. In many of the hospitals, you will find they are all wired with conduits, with Cat5 cables or power cables. But this is a very, very simple LoRa wireless application. You have to keep 3 buttons in the patient room and 3 buttons in the nursing station. And once they press the red one, it is emergency. If it is green, it is normal. If it is blue, that means the nurse has come inside and acknowledged. And once the nurse acknowledges and goes into the ward station, she can also send messages to maintenance department, food service department, housekeeping department, saying that this patient wants a cup of coffee, this patient wants a pillow, this patient is complaining that water is leaking in the room. She will be able to do that without talking to the departments, and these departments will get in touch with the patient, and everything is solved. So if a normal nurse call system is going to cost you about, say, 5 lakhs, this will cost you hardly about 1 or 2 lakhs, and it can also be implemented in a matter of 15 days. Believe me, whatever I am trying to tell you in a hospital can be implemented in a matter of 15 to 20 days. That is the power of this IoT system. And this is interesting, but I have not implemented it yet. And this can be very useful in restrooms. Maybe once you keep this counter wirelessly, LoRa-enabled counter will see the mobile signals of the people who come inside the room. and anonymously it will capture, and so it will tell that so many people are there, especially for social distancing. This can be very useful. Suppose you feel in a particular dining hall, if you find in a particular restroom that should be only about fixed number of people, if you know that there are at least 20% of the people more, then you can go and clear the crowd or clean the place, whatever. This is a very interesting new development that has happened. So this is in this hospital, we can switch off all these air conditioning systems. We can schedule. What we have done is, as per the NABH norms and as per the energy saving NBC guidelines, we have decided the timings of each of those AHUs. We have decided the temperatures that has to be maintained in each of those places. We have given it to the maintenance people, and we have also configured the all the AHUs. You know, it is a typical, it's a running installation in Kaveri Hospital in Trichy. It's a small hospital there, an 150 bed hospital. There we have about 5 or 6 AHUs. All these AHUs are in different floors, are all scheduled, and they are able to know what is the return air temperature, what is the inlet room temperature, what is the set temperature. All they are able to do. The technician, AHU technician, does not have to go to 5 floors, switch on and switch off, and everything is done automatically. We can also override the settings if you want at the will of the administration staff. So this is the plumbing system. This is again for a very simple hospital. If you have a Syntex tank, if you have a cement tank, if you have a sump, we can know sitting in your house. Maybe a doctor can know sitting in your house, in his house, whether the water came from the toilet board today, how much of water has come, how much water is in Syntex. He does not have to check with the plumbing. In course of time, because of COVID, there is a shortage of people. You are not going to get technicians. You have to learn to manage by yourself, and maybe people learn to do multitasking. An electrician has to do plumbing work, plumbing person has to do mechanical work, somebody has to do AC work, and so to do multitasking, I think nothing can be a better tool than this. So here you find this, again, this kind of analysis is simply not possible. Nobody is giving. IoT can give it in a jiffy. So you find that fire water tank is a classical problem. So we don't know at any point of time whether the water is there in the fire tank. This IoT, with an IoT sensor in the fire tank, I will be able to know what is the level of water. I can find out how much of water is in the treat water sump. I can find out what is the in the raw water tank, what is the level that is available, and what is the trend. Everything I can see. And last few slides, and this is again very interesting. Last few slides very interesting. It is like this. I have always had a problem. I have always had a problem answering some of the regulatory authorities, whether the drug inspector or an NABH authority or a government person. When he comes to the pharmacy, he asks me, where are your vaccines? Where have you kept the vaccines? And you know, he comes with me, and then when I open the refrigerator, he sees the vaccine and he says, where is the log? When I open up the log, to my surprise, I find that some logs or sheets are there, but it is not filled. But in some cases, logs are filled, but not completely. So I think, I'm sure this happens in many of the hospitals. It is going unnoticed, or at least people blink their eyes and they just shut their eyes and they just don't bother about this. In any hospital, there could be at least about 20 such refrigeration equipment, cold storage equipment, including food services area. And here in this, what we have done is we have put an IoT device, and I will be able to measure 24/7 what was the temperature and humidity in those devices. So this is a very interesting case study. In one of the hospitals, I found that I had kept about 10 of these IoT devices in the refrigerator, and this was in an emergency refrigerator. And I was in Coimbatore, and this was in some other place. So on one day, I simply opened up the screen and tried to see, and I found, you see here at 7:30 in the morning, 7:30 in the morning, temperature was 26 degrees in the refrigerator. I said, I'm wrong. I said that my IT is failed. I failed, my IT has failed, my sensor has failed, my Wi-Fi has failed. But I waited for 1 hour. I called my IT fellow and asked him, go and find out what has happened. He said, our IoT device is perfect, sir. Wi-Fi connection is perfect. You know what, sir? The nurses have opened the door and they have taken all the medicines and taking inventory of those medicines. I understand this is the practice every month they do. That means, you know, for 2 hours, the fridge was open. All the medicines were outside. And what will happen to the potency of the medicine? What will happen to the potency of the vaccine? So I think, I don't know whether I should blame it on myself, whether I should blame it on technology, whether I should blame it on the nurse qualification. Honestly, I don't know, but this definitely is a great boon for the regulators, and also for ensuring patient safety. This is a very good arrangement. This is how we get alerts. You see, you get SMS alerts, you get email alerts whenever the temperature breaches the normal values. You can set high critical, low critical, you can set all those values and all that. And the last is the spike in refrigerator number. This is a very classical case when many of the people, when they open the fridge, they don't close it properly. In a particular shift, I was finding all the time, you know, there was readings like this which were coming, and I found that every day at a particular time the temperature will go to 20 degrees. That means one nurse had a habit of not closing the door properly, and so everybody has to go and tell her close it properly. We'll close it, then the temperature will come to the normal level. So these are some of the examples I have. And quickly, the last slide, you may ask me, you said so much about IoT, you so much about cloud, but tell me how much it will cost, what should I pay, how should I pay? And it is on a subscription model. Please understand, it is very simple to implement, very fast, very cost-effective implementation. It will hardly take 1 month to implement. I recommend subscription model. That is, you have to pay every quarter certain amount of money to maintain that. Maybe if you have about 200 devices in your hospital, small and big devices, you need to maintain them. So it is something like an AMC for those 200 IoT devices. Then you have the setup cost. You have to, initially we have to set up that IoT software, hardware and storage. You set this up, and then you have an implementation cost. So when we do the implementation, once we do the implementation, we may take about 1 or 2 months. We have to configure, we have to maybe do some kind of software upgradations and things like that. That is a one-time cost. And once you have paid for the setup cost, once you have paid for the one-time implementation cost, then you have to pay for the annual platform and maintenance fee. And that will be about, I guess it will be about 20% of the total fee or something like that. I don't know, honestly. It depends on the size of the hospital. It depends on the number of IoT devices you implement and the number of parameters you want to monitor in that IoT device. So this is what it is. And thank you. And I think despite the initial technical glitch, I think I was running through a breakneck speed. And thank you for the tolerance of all the participants and the speakers. Thank you very much for this opportunity, and I hope this was visible and audible. Dr. Tulasi Raj, was it visible and audible?
Yeah, it was.
Okay, thank you. Thank you so much. Please go ahead. Okay.
Thank you very much.
I am done, sir. Yeah.
Mr. Ananthapadhmanabhan, thank you very much.
Yes, sir.
Thank you for an excellent presentation.
Thank you.
I'm really sorry for the technical.
No problem, sir. It happens sometimes, you know, in spite of having the best of the technology, it happens. It is perfectly all right. I'm only sorry that participants had to wait for some time. I apologize for that inconvenience caused to the participants. Okay, please go ahead.
Thanks a lot, sir. Now, next I'm going to invite Mr. Thulasi Raj, Executive Director of Lions Aravind Community Institute of Ophthalmology and founder member of Aravind Eye Care System, to deliver his talk on EMR and patient engagement. Mr. Thulasi Raj, please.
So I think you have to stop the screen sharing. Yes, sir.
Yeah, I will.
Please stop sharing. Yeah.
Yeah, I have done that.
Yes, sir. Thank you, sir.
Thank you. So hopefully my screen is visible now.
Yeah, it is.
Okay, fine. Yeah. So first I want to thank Dr. Panneerselvam and the CII-Erode for this opportunity to share some of our ideas in the current crisis. So even though what triggered this talk is this thought process is the current crisis, we realize that what I'm going to share can live far beyond this stressful situation as well. There has been a saying that you should never let a serious crisis go waste. And this is a humongous crisis that we're all facing. And it will be a pity if we don't get some lasting benefits out of this. So that's what really triggered the thought process within us, which I'm sharing. And I think it's relevant to everyone, whether it is a big hospital or a small hospital. I think one thing, as we're all getting back to business, I think the challenges that the hospitals now have are essentially twofold. Now, one is ensuring the staff safety, and through in the workplace contamination and so on, and also the patient safety and building the patient trust, that this hospital is a safe place to come, which means following a lot of protocols for social distancing and so on. The impact of all of this, especially in busy hospitals which have a capacity issue, would be on capacity reduction. And this can be quite significant, and capacity reduction has a lot of implications, starting with revenues to staff morale to, we will not be able to pass on everything to the patients on a long-term basis, even though today some of that is happening. So we are equally affected by this in Aravind, given our size and the volume of patients that we see. And we are one of the hospitals where we don't have an appointment system. People just walk in. And I'm kind of sure that that's the situation with many hospitals. So when you don't have a regulated patient intake, what happens is patients come in bunch. So for instance, in our situation, the patient arrival is very skewed. That is by about noon time or lunch time, about 85–90% of the patients have come in, even though we are open for patients till about 5 o'clock or 6 o'clock in the evening. So the afternoons tend to be fairly slack. So then we recognize that if we can somehow smoothen the demand, and then we did some mathematical modeling to see simulation to see what would happen if we had an uniform intake. And then we were quite surprised that even though we have to have a lot of restricted workflows, we would still be able to manage more than 90% of our patient volume if we could regulate the flow. So we have put in what we call as not an appointment system, but a scheduling system. Now, wherein as the patients come in, we kind of regulate them, saying that we cannot take in more than a certain number of people into the system. Now, very much like what Tirupati does, sending people for darshan. So we did this scheduling system, and that has helped quite a lot because in our smaller hospitals, the demand has almost rebound, to 70–80%, and they're able to see all the patients. So this we realize will help us at this time of crisis, and it will help us even more, when the crisis is over and we can get on to more normal protocols with the patients. And this I see, this I know is relevant even in our smaller setups. The other one which I'm going to focus on pretty much on the next few slides is on the electronic medical record and associated hospital management system. Because when we talk of digital, we had Ananthapadhmanabhan talk about all the facility and equipment management and so on. That is one aspect of digitization. The other aspect of digitization is in the entire patient engagement process. And I'm not going to be talking about account stores, and they have been there for decades now, and I think many of you must be already into that. So to me, I think what gives a lot of opportunity is electronic medical record. I think some of you would be having it, and if some of you don't have it, it may be a good time to consider that. I'm just going to give 4 examples of how we can leverage electronic medical record beyond its primary purpose, which is documenting the clinical data that we collect. So one of that is, in any system, you would have your bottleneck. And then the bottleneck is essentially what will decide your throughput or how many patients you can see and so on. So in the current context, I'm just taking one example. Now capacity becomes a bottleneck. So if capacity becomes a bottleneck, I think the cardinal rule is you never make a bottleneck do wasteful work or unnecessary work. So one of the places where we are going to look for waste is the number of visits it takes to close an episode. No, it could be for something as simple as giving a pair of glasses, no, or doing a workup for glaucoma or diabetic retinopathy, no, or cataract surgery. So if we can define an episode, which should not be very difficult, then with an EMR, we can quite easily monitor how many visits it took to close that loop. And then we can also determine from the EMR what was done on each visit. I can give a simple example. A few months back, we do this focus group discussion with our patients. We make about 10, 15 patients sit together around the table and we ask them their experience of the visit to the hospital, and we do 2 groups each day. There was one lady who was quite upset. She said that I was advised to undergo OCT, and because the schedule was full, I was asked to come another day. And then I landed up on that second day, and then it got delayed, and by the time they did my report, the test, the doctor was not there to interpret and give me the final diagnosis. So I was asked to come another day. And the third day when I came, everything worked well, and within 10 minutes I could leave. But she said, couldn't this be done in a single visit? No, I'm coming all the way from Trichy. So she was really, really upset. So this is what I mean. So by minimizing unnecessary visits, we could actually free up the space for more patients to come in. And the patients also would enjoy this because they are not making unnecessary visits, and they're also saving a lot of money by not coming that frequently. So this would be a win-win for both hospital and the patients. The second one is with the digitization, we have a scope of shifting a lot of tasks to the patients. And this is not something very unusual. I think all of us have experienced with the banking. Now, none of us would probably go to a bank to withdraw money. All of us go to ATM. And the same thing with booking cinema tickets or train tickets or plane tickets. When things become normal, all of us do it online. And then that is something which we also like. We feel we have more control. The same way can we shift tasks to the patient. And then with the digitization, I think it becomes immensely possible. And I've seen this happen in different settings, which I will talk briefly about. For instance, even before the patient comes to the hospital, there's quite a lot that can be done, through, for example, the registration can happen online before they come. We can even do history taking in a much more complete manner, either through a manual process of calling and talking to them, or through chatbots and things like that can be done. Now, more and more patients are coming with insurance, and insurance paperwork we know takes a lot of effort and time. We can figure out a way of doing that also before the patient comes to the hospital. Same way, a lot of health education can happen outside of the hospital. They don't necessarily have to be with us. And similarly, even when they are within the hospital, with the EMR, we can easily build an app which can interact in real time for that visit, which means the app can guide the patient to the laboratory or to the X-ray room or wherever they have to go, within the hospital navigation, which quite often, if it is a multi-floor hospital or a slightly larger hospital, requires someone to escort them, and that can be reduced to some extent. One can keep the patient fully informed, of how much time it may take or the wait time, or so that they're not unnecessarily anxious. And then quite often we have to kind of brief the patient for each investigation. In our case, if it's a slit lamp, how do you place your head, or what will be done? Or if it is refraction, what will be done, and what the patient has to tell the refractionist. All of that we can brief the patient specific to that particular condition they have come from. It's not general health education. So they're waiting for laboratory, X-ray or refraction. They get that specific information coming to them. And of course, digital payment is another one wherein the patients don't have to queue up and things like that. It can be all done. You can push the bill to them and for investigation or lab tests or whatever. So this is another option wherein you are kind of shifting a lot of stuff to the patient in a way that they will like it. And because the patient does it, it is likely to be a lot more accurate than our staff doing it 100 times during the day or something like that. The fourth idea that we are working on is looking at the cycle time. Now, basically, the capacity is also determined by how long a patient has to stay in the hospital before they can get all the investigations and leave. For this, with the EMR and hospital management system, we can closely monitor the cycle time. Now, with this, we can set time targets. And once you are able to do this, now one can do a complete root cause analysis for all violations. And with the EMR, the data can be more readily kind of culled out and analyzed. Manually, it will be impossible to do. And with this, one can continually come up with different action plans, which could be rationalizing investigation, cross consultations, and so on. And maybe sometimes you may have to invest in certain load balancing, maybe appoint an extra person or buy a piece of equipment. And all of that would significantly enhance the overall throughput of the system. And the last thought that we have is around telemedicine. And this is becoming a reality now when the patients can't travel. So they're calling up the doctors through phone, WhatsApp, whatever. And we recognize that this can become something of a permanent kind of intervention of how we provide care. So why should be a patient visit us if they don't need to? So this is what you're seeing is a typical EMR with a list of patients for a doctor to see, for example. And today, this is how it will look like. If you can seamlessly integrate the telemedicine, maybe against each patient, it would indicate like a camera symbol to indicate that this patient is not there in person, but will be available on a video screen. So just by clicking on that, we should be able to immediately connect to the patient via video and have the conversation. So it could be video, it could be a phone call, or it could be an SMS, whatever. So the idea is that today the EMR can be tweaked, so that the entire tele care or telemedicine can be seamlessly integrated. So you're seeing a remote patient, and the next patient is a real patient who's waiting in the waiting room. So this can flow quite well if we can with the MR. This is possible to do. So all that I'm saying is not something which is theoretical. We're already made some progress in some of the things, and probably in a few months' time, all of this would be up and running and also available to others. This is one hospital in California called the Kaiser Permanente Group. So this is last year's data, 2019. They have handled 148 million patient encounters. Unbelievable number. Now, of this, close to 150 million patient encounters, almost 60% of them have been digital engagements. That means the patient did not physically come to the hospital. Whatever was their need, maybe a prescription, some query, they want to look at lab reports or whatever, was all done digitally. And this is something that I think in India we should embrace, because this would also very, very significantly reduce cost to the patient. And all that I have kind of told now is not something which would anyway affect quality. And on the other hand, I feel it will reduce patients' satisfaction and experience, reduce cost to them, and also eliminate what I'm calling as waste, any unnecessary visit to the hospital or engagement with the hospital staff or capacity, I would call is wasteful if it can be avoided. And I think our calculation shows that if we can pull this off, we would actually enhance our capacity by as much as 30%, even during the COVID times. No, and this can be 50-60% once the COVID restrictions go away. And all of this will not only enhance patient satisfaction, but also hospital revenues as well. So in concluding, the pandemic is not going to severely affect the various health conditions, even though it may dampen the demand in the short run, depending upon the transport restrictions. And it's not, and where the healthcare or any hospital is not been uniquely victimized by this virus. You know, all of us are equally affected. So I think this has given us a tremendous stimulus to think really out of the box, you know, to innovate and stay relevant. Thank you.
Yeah, thank you, sir. It was an interesting presentation. So I have one question. So what do you see as the potential for teleconsultation in ophthalmology? Because what we see is when the patient is directly trying to consult the ophthalmologist from his home, we have this impediment of seeing because ophthalmology depends on image capturing. You have to see the cornea clearly, the retina. So there is a lot of concern among ophthalmologists on the teleconsultation part, because maybe we can give some basic advice, but still I feel that there are a lot of devices which has to come into the patient homes, so where they are able to take up image clearly. So what is your view on that, sir?
Yeah, what you say is very true. I think I think all of these things will evolve. I think today telemedicine is not evolved. The gadgets have not come in because the market doesn't exist. So we have to make a beginning to start with. You know? So at the very minimum, we can do some triaging between emergency, not emergency. That should be possible by listening to the symptoms and things like that. And we can also give some, like you said, some basic kind of advice to the patient to follow so that things don't become bad. No, and today everyone has got a smartphone, or most people have a smartphone with imaging capabilities. And I think we will come up with some very innovative ways to help the patient do the imaging. You know, like I think Shankar Netralia has already released a simple video of how a patient can photograph their eyes using the rear camera, which is got the better resolution than the front camera. No, so they've advised the patient to go stand in front of a mirror so that they can see the image coming on the screen, no, and then click it. No, so they say they're able to get reasonably good images when the patient is able to follow that. So I think a lot of these small innovations will happen, and there are quite a few people who are now bringing out simple lenses to attach to the smartphone, you know, which can take good like a slit images or even retinal images. No, so all these are very early stage, and it will evolve. And with like everything else, I think development happens when there is demand for it. No, so that is my prediction. So we should not stop innovating or exploring because things are not there today. This will be a chicken or egg kind of a problem.
No, I think till that time, maybe the B2B models where the teleconsultation can happen in an optical shop or
yes.
I think
that is there quite a lot. That is quite evolved. In fact, at Aravind, we do every day about 2,500 consultations. I know that you yourself do a lot of retinal image reading. I don't know what numbers, but so that is B2B is already there. So I forgot to mention that. What we need to change is build this B2C model. You know, B2C model is very challenging, and that is where we have to learn from organizations like Amazon or whatever, you know, where they have done that very well. Yeah.
I think this market will explode when there are very low cost, reasonable quality imaging devices. Say a fundus imaging device for 25,000 rupees or 50,000 rupees. Then we can deploy it in a general practice clinic and all those places. Thank you, sir. It was interesting. Maybe we can take up the audience question towards the end of the session.
Okay.
I would like to invite Mr. Siva Ramakrishnan, who is a good friend of mine. I know him for a short time only, but he has been, he is a combination of an auditor and a financial manager. So it's very difficult to have that kind of a combination, and he's a very excellent speaker. So he keeps speaking in a lot of webinars. He does a wealth management service for almost 300 to 350 high net worth individuals in Chennai and all over India. So Siva Ramakrishnan, the idea of bringing in Siva Ramakrishnan was to basically, I think whatever the IT and everything coming up, but still the hospitals have to focus on the basic accounting things. So basically, only if the accounts are created properly, then we can enter it into the IT systems. So right now, there is a lot of difficulty, resistance, I would say, or lack of awareness among the doctors where the accounting doesn't happen properly. So Siva Ramakrishnan would say how he is thinking and why we should account and what is the benefit of creating good accounting systems. And maybe I'd like to like him to share his thoughts for the next 10-15 minutes. His speech was supposed to be the first, but I think because of the technical issues, we had to postpone it. Siva, now you can actually take over and start talking.
I'm audible?
Yeah, you are audible. You are audible. You can.
People out there?
Yeah, everything. We can see that. So, yeah, go ahead.
Yeah. Thank you so much, Dr. Sendil, Dr. Paniselvam, and the entire family of CII. It's going to be a nice interaction, and I've been listening to the lectures of the expert medical practitioners for the last half an hour. A lot of it actually sounded like Greek and Latin to me, but I did learn that there are a lot of innovation underway, and very nice to know that we are going towards a digitized economy as far as medical field is concerned. In fact, one of my last interactions when Nirmala Sitharaman ji was here in Chennai about 7 months back. One of my I had a one-on-one interaction with her, and one of the points that I highlighted to her was the medical equipments sector, which needs to be a lot more digitized, and a lot of new age practices have to be brought in force, which needs a lot of support from government, is something that I highlighted to her. So with this background, let me step into my presentation. I got about 15 minutes to go, I guess. So here we go. So digitization and the new world of new order of reality. That's a topic here. So just briefly, this is what we are. We are a family office, one of the leading family offices in South India. As a family office, we manage assets and liabilities of, at this point in time, about 350 families odd, roughly about 200 crores of corpus across different asset classes. We raise funds for a lot of businesses, including several hospitals, doctors, in creating assets and creating business value for all of them. We advise on mergers and acquisitions, corporate valuations, diversification of businesses into new areas. For example, let's say I've seen a lot of doctors and a lot of medical practitioners approach us to find whether to buy an equipment or not. It's a very important decision that impacts smaller hospitals, isn't it? To go for particularly equipments of ophthalmology are very costly. Make decisions on that front is something that is very important before we step into that. So as I get into this presentation, let me highlight to you that some of the key revolutions that have taken place in the last 40 years have impacted our lives very deeply. So advent of television in 1980s took entertainment and news into the homes of India. Internet was perhaps one of the greatest revolutions that the last century had seen. 1990s, today internet is available across the nook and corner of India. Even the rickshawalas, using WhatsApp, isn't it? It has completely changed the way we live. There's if there is one thing that we can live without, even we may live without our women at home, but one thing that we may not be able to live without is mobile. So through the day, through the night, it's with us. 3G technology changed our way of handling things. NBFCs, advent of NBFCs, which perhaps happened unnoticed. So the way borrowing was done in India was changed forever, because borrowing was always based on assets, that is properties that we own. The NBFCs came in and they started lending without properties, helped develop a lot of businesses. In fact, I used to head Kotak Mahindra Bank for Tamil Nadu about 12 years back, and you were sanctioning authority there. I clearly saw this wave emerging starting from 2006 onwards. Mutual funds completely changed the way investments started happening, that started in the 1990s. These are all some revolutions that we have seen in the last 40 years. The revolution that is underway today is digitisation, isn't it? So I would say, while the digitization has been there for last 20 years or so, it got a lot of momentum starting from 2015 with some major reforms that government initiated, and that were reforms were initiated by government, and that were the economies of scale of India and also of US and other Western markets started adopting, and it became a way of life for us. So we are still in the early stages of digitization, very early stages of this digitization. And there's no end to this digitization as a process, because there's only going to be innovation and constant innovation underway. So what is digitization? It's, just to get into some basic stuff, it's basically a transformation of information in digital format, isn't it? From financial perspective, from medical perspective, from whatnot. Now, with digitization in place, the reason why I'm talking about all this stuff is that I look at it from the point of view of somebody who is running a small hospital or a bunch of clinics out there, who's handling cash, who is receiving them, because the challenge of doctors, medical practitioners is that all of us receive cash, right, as a remuneration. So while this is the state of affairs of medical professionals, end of digitization is something that's totally far away, totally something very different. The world is very different. So in order to bridge the gap, if you try to understand what's happening around in India, government services have become digital. So a few weeks back, I was myself surprised to see that government announced that a PAN card, which used to take about a month and a half to get about 5 years back or 5-6 years back, today takes only about minutes to get. Is it not phenomenal innovation that has happened in India? Who is driving that? Government itself is driving that. Payments have become digital, accounting, reporting, compliances, communication, every aspect of life is getting digital. Events that push digitization into India, from here on, I'm going to talk a little more into finance. From financial perspective, digitization, GST, demonetization, GST, and COVID. I can assure you that as much as demonetization and GST that impacted digitization, COVID is going to impact digitization equally. Something that it's been a transformative event. So with demonetization, people started getting into digital. I don't need to tell you about the story as to what happened. GST again pushed us to digitization. So did COVID-19. So what's the necessity of digitization? We need to understand the concept of digitization from a finance and numbers point of view. There's a very important thing that we need to understand, that what we call the white economy and the black economy. The white economy stands at about $2.2 trillion. Now, if somebody says that India is a $2 trillion economy, I wouldn't agree with them. I'll tell you why. India is actually a $4 trillion economy, but a $5 trillion economy. But what is actually accounted and revealed is only $2 trillion, right? So as much as is accounted and revealed, so much is more outside which is not accounted, isn't it? What's the kind of wealth that is being accounted and reported? It's for that reason that I used to joke around that, if lights are flashing on the streets, the water is coming down the pipes, it's all because of people who pay. Those 10% of the population that is actually paying tax. 90% of the population is enjoying what 10% is paying, isn't it? So black economy stands at a whopping 93 lakh crores, which is 62% of the entire gross domestic product of India. What is GDP? Let's say your revenue of your hospital is, let's say for example, you're running hospital revenue is about 1 crore per annum. So that's your revenue, isn't it? So the revenue of India stands at $2 trillion. So 62% of that entire revenue of India is unaccounted. Can you imagine the size? Humongous, right? So this is going to, I can assure you that this is going to change. It's already changing, and it's going to be transformed completely over the next 15-20 years. And that's what we're heading towards. Are you willing to be part of that wave? An issue that we have inherited from the past. What is that? See, I have spoken a lot of IMA forums, and I have interacted. I had the chance and privilege to interact with at least about 1,000 medical professionals in the last 2-3 years. I have got a lot of learning from them. One of those things that I have seen with them is that they run their business on cash, isn't it? So with that being the case, they are forced to deploy the cash in assets that they can deploy. Where can they deploy cash? Biggest opportunities for deploying cash is properties, isn't it? Properties and gold. So if they try to deploy, on account of that, people invest in properties and gold. Is it because it's a great investment to make? It's because they see a lot of potential in those properties? Certainly not. It's because they perhaps see that as the only option that where they can utilize the money. In fact, I have known, I've heard people, who would have commented that they are not able to step out of their houses because they are having some sacks of cash at home. So why get into that model at all? And why do people accumulate properties? Allocation of funds and property is high because people need a place to deploy cash, right? So, and in reality, that an unutilized asset is a debt investment, isn't it? It's debt investment. So I don't need to. We don't need to read books of economics and economic times or business line or hear from me, people like me, to understand that in the last 5 to 6 years, properties have not been fetching returns, right? Property prices have either stagnated or come down. We are not against property investments at all in first place, but we are trying to look at assets that can move up, assets that do not move up, right? We are locking in money forcibly into assets that have not been moving up. Because what's the reason? Because that's an opportunity that's the only place where we can lock our cash, right? 10 years back, my friends, 15 years back, if somebody wanted to buy a property, sell a property, they would, don't you remember the times when we used to ask for at least about 70% in cash and about 30% in check, or probably 80% in cash and 20% in check? So what's the situation today? An average seller is asking 100% in cash, 100% in check, 100% in check, isn't it? Cash is not accepted. That shows the kind of transformation that we have gone through, and that's still underway. It's still a long way to go. Now, to highlight to you as to what's happening in the distribution of household assets in India, the point that I'm trying to drive to you will be quite visible from what you see on the screen here. This is the data that has been produced by RBI. About 56% of India's properties are locked up in, India's household net worth is locked up in properties and gold and some insurance funds. There were days when, several years back, when we used to be able to take endowment policies of LIC of India paying cash. Isn't it? Some of them still permit up to an amount of 50,000 rupees only. So on account of that, look at the distribution of assets, distribution of money between these three assets, about 75%. In fact, this is whole of India. If you take out the states like Gujarat or Bombay, then investments in properties as a percentage of one's net worth will be as much as 75% or more. In fact, with the doctors community, I find that the investments in properties and gold stands at nearly 98 to 99% of individuals' net worth. It's surprisingly very high, and it's not healthy at all. It's not a healthy trend. Now, what's the situation with property? Why am I saying that we are locking our money? I'm trying to point out things that are not good for us, and then trying to tell you how to change, how to go about changing our culture into digitization. So this particular slide shows you the rental yield of every asset, rental yield on properties of different countries across the globe. So what is rental yield? Let's say you own a property of rupees 1 crore, and that is going to fetch you rental of 2 lakhs per annum. Let's say 20,000 rupees per month, which means about 2.4 lakhs per annum. Then the rental yield is about 2.4%, right? 2.4 lakhs divided by 1 crore is 2.4%. That is rental yield. Now look at the rental yields of Singapore. That's 2.83%. You can see that at the left corner of the screen. 2.83% is the rental yield in Singapore. UK 3.21. UAE 5.82%. Right. The interesting part is that the cost of borrowing in those countries. In Singapore, let's say if somebody wants to buy a property in Singapore, the cost of borrowing comes to just about 2%. Now, borrowing at 2%, they acquire a property which is going to fetch them rentals of 2.83%. It makes sense, isn't it? But what happens in India? In India, you buy a property worth about 1 crore and lease it out to be an apartment. I'm not talking about land here, my friends, because land is not producing rental, isn't it? It's a dead asset. I'm talking about land. I'm talking about properties, rentals, which let's say rental is going to be about 2.4%. What's the borrowing cost in India? At least about 8%, 9% at the least, right? So borrowed 9%, lease it to people at about 2.4%. The net loss is going to be about 6 to 7%, right? Perhaps the last 30, 40 years, we have seen a phenomenal appreciation in property prices. We haven't felt the need for not investing in properties, right? But in the last 6 years, ever since 2013 or so, property prices have not appreciated. Money has stagnated there. This is when we realize that property prices are not going to appreciate any further, and rental yields are also lower, right? So we need to come out of our old practices to ensure that we grow our hard-earned money. That's a point that I'm driving to you, my friends. The necessity of digitization for doctors and hospitals, especially smaller hospitals. See, I have heard from quite a few doctors that this is a story of pilferage, right? They have had collections, enormous collections, work very, very hard. Doctors work very hard. They work for about, people work for about 80, 90, 14, 15 hours a day. But there is somebody sitting at the counter, the doctor sitting inside is not going to collect cash, right? So somebody sitting at the counter is going to collect cash. Very, very, very hard to control collection of cash, and how much is deposited, how much is collected, how much is deposited, who is going to account that? So pilferage is something that something very hard to avoid. Scores of professionals have lost crores of rupees on account of pilferage. I'm sure many of you would agree with me. But there are also people who say that, well, it's not the case. For those who have not lost money on account of pilferage, perhaps you've not checked your books of accounts. You haven't checked it at all, right? That's perhaps the reason why one wouldn't know whether you have lost money or not. So it's very important that money is accounted properly on a daily basis. Daily basis, my friends, not on a yearly basis. Daily basis. Your auditor comes to manage your accounts at the end of every year, like policeman coming at the end of the climax of film. But in reality, accounts should be maintained on a daily basis. The drawbacks of not digitizing the business. This is something very strange. Why do people work very hard? Of course, we are service oriented. We would like to serve the people. Jan Seva, all that is okay. But at the end of the day, the objective is also to create wealth, right? People don't know, hospitals and doctors don't know whether actually they're making money or not. Do people know about it? So what's the cost, what's the revenue, and what's the net margin that we're making in business? Are we aware of that? Most of the people are not aware of that. So what happens is really that sometime around June or July, we request the auditor to come over, and gentleman comes over and sees all the numbers and finally asks this person, sir, please pay tax. I will pay. How much do I pay? How much do you need to pay? And people calculated from last year. Last year, let's say you paid 100 rupees. Sir, please pay at least 10% more than that. Okay, let's say 110 we pay. That's it, isn't it? That's what really is really happening around. Is the way it should be accounted for? No, certainly not. So let's not look at the finance professional or auditors as policemen who can't come at the end of the year to do accounting, right? In fact, by the time they come in and do accounting, look at accounts, 6 months of the next year is also gone by. They're already into the next financial year. So there is no way we can correct what has happened in the last financial year, right? So accounting should be forward-looking. Accounting should be maintained on a daily basis, and you need to have clear perspective as to whether you're making money or losing money on a weekly basis, on a monthly basis, quarterly basis, on an annual basis. And when do you need to know that? Not at the end of the financial year, but at the end of every month. Ideal situation, every profession should know their monthly or quarterly profitability. Accounting is key to successful business. Bane of medical professionals, lack of freedom. Cash dealing leads to lack of freedom. And at the end of the day, we lock our money in assets, as we have seen. It could be properties, it could be several other, chit funds, right? I've seen people lose a lot of money in lending money to unknown sources or to chit funds. Most of the chit funds that are there around the country, I can tell you, my friends, are unregistered chit funds. Please make note of it. Unregistered chit funds. There is something called Chit Funds Act. People lend money onwards to chit funds, and most of them are unregistered chit funds, prone to substantial risk. So we need to avoid those kind of situations. We are prone to do that because of my cash management, right? Let's come out of that situation. Tax compliance is a very serious problem. So, I'm sure as medical professionals, you don't want to think of something that is totally unnecessary, lose sleep over that, right? So lack of proper accounting leads to income tax issues. And I can tell you, my friends, that please remember that there is an invisible eye today that is watching all of us, right? That invisible eye is led by, not by mere income tax officials, but by algorithms which judge as to how much of money is being reported and how much of assets are being created by individuals. It compares and defines. So if you look at this particular slide, so what's happening in income tax assessment? Faceless assessments. So gone are those days when you can depend on your auditor to go and fight with income tax officials to solve some problems. You know what's happening? You're going to be filing the returns in Chennai, and somebody sitting in Baroda is going to assess your income tax returns, and you're never going to be meeting them, right? How are you going to manage? The probability of managing this kind of situations are not going to be there at all. So scrutinies are going to be digitized, right? And picking up the file that is going to be picked up for scrutiny is also going to be digitized. It's also digitized already, in fact. So there are many parameters that are applied. For example, people are buying property. Let's say somebody has bought a couple of properties this year. Then automatically the system verifies as to how much of income is being reported. How much of income was reported in the last 4 or 5 years versus how much of properties that have been bought in this particular financial year, and compare. If there is any anomaly or mismatch, immediately hand is raised and something you get a notice out of it. Upcoming events, probable events. Government, this is something very, very important. It might happen in near future, but government has set for this. Government may seed Aadhaar number to every single property document. So what does it mean? Today, all the property documents across the country predominantly is not in digitized form. Now the digitization is in progress. Some of the states have 100% digitized their property documents. Over the next year or two, all the property documents will be 100% digitized. Then it takes only minutes to seed every seed Aadhaar numbers to every property document. If that happens, we click on the button. If in a particular Aadhaar number which is mapped to a PAN number, they can see how many properties are there. Let's just list them out, right? Click on the button. The income tax officials or enforcement directorate can just click this button and see this particular PAN number, this particular Aadhaar number, about 12 properties, right? And understand how these 12 properties were purchased when the person has not reported income in the last 20 years or so. You know what I'm saying, isn't it? So we need to be very careful in income tax assessments. So gone are those days when we can manage improper accounting, improper reporting. The times ahead are going to be different. Now, please understand this concept carefully. Paying income tax. Again, I've been asked this question several times when I speak in forums. So people ask me, should I pay tax 30%? I'm going to be losing huge money on that, right? Something comes up very often. Paying income tax and investing properly versus avoiding tax and forced to invest in low growth asset classes. My friends, just take a calculation, simple calculation. You got about 1 crore of income, for instance. You're going to pay, you look at column number 2, paying tax and investing properly. Tax paid is 30 lakhs, 30%, right? Actually, it's not going to be 30 lakhs. It's going to be lesser than that. Let's assume, take it at the highest value of 30 lakhs. Income after tax is 70 lakhs. Now, 70 lakhs, if it's available in accounted form, legitimate money, can definitely be grown at 12% per annum. Growing at 12% per annum, the corpus is going to become 2.37 crores over a period of 10 years. Now, what happens if the proper money is not accounted? 1 crore, zero tax, well, fantastic, 30 lakhs saved. But what happens after math? Growing at 3% per annum, because you're going to be investing in assets which are not going to be growing, isn't it? 3% per annum, and the money becomes 1.34 crores only. Now, 1.34 crores compared with 2.37 crores, the loss is going to be 1.03 crores for a period of 10 years. What does it mean? Annually, the person is going to lose about 8 lakhs. That is 8%, my friends, of the annual income. 8% of the annual income, merely not for the reason that they're not paying taxes, reporting the income. So is this not worth paying tax and getting into the system and use the funds to invest it properly? So report your income. No digitization means lack of records. Lack of records means no availability of finance. No availability of finance, lower business investment. Lower business investment is equal to poor wealth creation. We have raised funds for a lot of hospitals and doctors. Very important to have your income tax returns properly done. Have your P&L and balance sheet filed properly, show at least some income, good quantum of income out there. When you do that, you are eligible to borrow money at excellent interest rates. Government is encouraging that. Banks are encouraging that. And you can invest them to create assets. Ambani has become Ambani because he has borrowed a lot of money. Please don't think that he was born with the rich spoon. He's not born with the golden spoon, isn't it? So borrowing is nothing wrong about borrowing. But one can borrow money only and only if we are reporting our income taxes properly. We're eligible for borrowing and we can create assets with the money that is being borrowed. Now, what is the action that needs to be taken? Let's understand, let's look at it from a positive perspective. Now, friends, if you really understand that digitization, not following what's going to happen is risky, then let's understand what needs to be done, right? Something very simple. Maintain proper accounting. It's nothing difficult at all. It's not as difficult as using an IoT equipment as one of the senior doctors spoke. Perhaps that's also easy. But to me, this is very simple, isn't it? Maintain proper accounting. Tally, QuickBooks, there are many softwares that are available. Avoid pilferage and know your monthly profitability. Now, how do you do that? Are you equipped to do accounting? Please don't get into this accounting job. That's not your core. Don't even appoint an accountant to do that. Outsource that. It's very cost effective. Outsource that. It's going to cost perhaps even 5,000 rupees per month, or even less than that. Depends on the scale of your operation. And the highest that it could cost would be about 50,000 rupees if you're running a large enterprise. Right? Don't spend it. Don't hire accountants yourself, because you don't know how to monitor them. It's like myself hiring a doctor under me. How do you monitor a doctor? I don't know what the subject is all about, right? Outsource it, give it to professional. They will run the job for you. No need to hire full-time accountants. Save cost and double your efficiency. Double your efficiency significantly. Take out your botheration, put it on them. They will run the show for you. And instance of digitization, instance of how to go about managing financial transactions. At our company, the name of a firm is Syndication. In our company, we serve the needs of 100+ enterprises in management of finance, management of accounting, right? On account of that, they are completely rid of their headaches, right? It saves about 60% cost for them. If they were to hire their own accountants versus giving it to them, giving it to us, it saves significant quantum of cost for them. It's not only cost that matters here, but creates significant benefit for them in doing that. Please find your person and give it to the right outsourced person and let them manage it for you. The reason why we are able to create such a massive difference for clients in doing what we are doing is that the same person will be doing accounting for about 3-4 firms, right? So that creates economies of scale. It's like, one bunch of doctors using the same equipment, right? Same ophthalmology equipment. If it's going to be used by about 4 or 5 doctors, cost to share. That's what we do, right? We bring the best of quality, but at the same time, the doctors get the benefit of cost. Start accounting, action to be taken. Please avoid dead assets. Please don't get into investing again and again. Lock yourself with assets that you're forced to lock in. Get into financial assets. How can you get into financial assets? Only if you report your income. And please understand that this is the way forward. It's going to be highly beneficial. And what are the financial assets that are possible? Bonds, debentures, mutual funds, equities, even commercial real estate assets. So to cite you an example, we have ourselves seen. I don't need to read stories I don't need to read textbooks to tell you what's been the return of the past. I can see it in my own life and lives of people for whom we manage funds. We accomplished about 16% returns per annum in the last 15 years, about 10x returns, 10x multiplication of money. For example, somebody was sitting on funds of rupees 1 lakh, that would have become about 10 lakhs over a period of 15 years. Right? Is it not a compounding of sorts? It's not multiplication of sorts. And that is possible only if you get into proper financial accounting and proper financial filing, investments. Please get into the procedures. Number 3, use digitization, digital payment methods. Please avoid cash transaction. We may, as the doctor said earlier, please use your banking, please get credit cards. Get people to use credit cards, go for swiping, use Google Pay, so on and so forth. The options are too many. And I don't want to get into the details of how BIM works, how UPI works, or how Google Pay works. All of you know that it's quite simple. Please adopt these modern age technologies. Don't get into the process of handling cash. Or please avoid that. That will make your life very simple. And there's no administrative hassle also, isn't it? Benefits accruing on account of digitization. It stops pilferage for you, protects your hard-earned money. On account of digitization, you can make proper investments and let your money multiply over time. No tax issues, you can sleep peacefully. Lesser administration hassles, lesser work. Is digitization a friend or foe? I can tell you that digitization is great, friend, so long as you're able to adapt to the needs of digitization. If one is going to crib and say that it's going to be very difficult to adopt, it's actually not difficult to adopt. It's quite easy to go about doing that. So let me also point out to you what kind of, something that I'll just go back to this particular slide once again, to tell you the benefits of significant benefits that's going to accrue to you. And I think we are coming to the end of the presentation here. Stop with this. Please remember this particular point, that so long as you're going to be accounting your income, paying tax, bringing your money in a legitimate manner, you're going to be able to invest your money and multiply your assets significantly. And that's going to be about, please understand this particular number, it's going to be as much as 8% on the income that you earn every year. What is that 8%? That's a saving that you can achieve by reporting your money to income tax and investing it properly. And where can you invest? Please create financial assets. Financial assets as in bonds, debentures, which can fetch you a fixed 10% per annum. Government invest in government bonds, invest in bonds of public sector enterprises, banks, 9 to 10% returns, 3-4% more than fixed deposits. Please do invest that. They are available to you, mutual funds, right? equity investments, please go for that. Number 3, importantly, the base for all this is proper accounting and proper reporting. Please understand whether you're profitable. You'll understand whether you're profitable or not on a monthly basis only if the revenue is accounted, revenue and cost is accounted on a daily basis, at least on a weekly basis. So in order to do that, please outsource your accounting. Don't keep it within in-house. It's very difficult to adopt that. So digitization is very easy to adopt. It's not difficult at all. Please embrace, protect your wealth, grow your money. Jai Hind.
Yeah, thank you, Siva. I think it was very interesting. A lot of insights in your presentation. Basically, maybe we can start off with a few questions. Maybe I will start off with a few discussions which are happening in the doctors group. Maybe you as an auditor can also advise us. Actually, the corporate tax rate has been reduced to 22% for a private company. Most of the doctors are running their clinics as a proprietorship or a partnership model only. So, and the proprietorship gets taxed at 30%. So, is it worthwhile to convert it into a private limited company, the practice into a private limited company, so that we can?
Dr. Sindhu, glad that you asked this question. So, please understand 2 things here. Depends on the scale of operation. Now, for somebody, we need to calculate the numbers more specifically. But just to give you an overview of that, if somebody is going to earn in individual's case up to 5 lakhs of income is tax-free. Beyond 5 lakhs, the tax rate is 20%. Beyond 10 lakhs, tax rate is 30%. For somebody whose net profit or net income is only going to be about 20 lakhs, they are much better off in using their individual names to go and file income tax. Right? They need to adopt a company. But if they find that they're going to be growing significantly, and the net profit or net income that they're going to make annually is going to be about 40-50 lakhs or much more than that, definitely makes sense to go for either of these 2 structures. One, a private limited company or a LLP, limited liability partnership. Both are equally beneficial, but the advantage of private limited, as you said, is that tax rate is only 22%. So summation is that if the income is sizable, definitely it makes sense to go for a private limited company. If not, better to stick to the structure of proprietorship, or ideally adopt an LLP, limited liability partnership. So that's going to be highly beneficial for limited liability partnership, where the liability is limited. Liability is not unlimited. In a proprietary concern, liability is unlimited, right? Adopt that LLP or go for private limited company if the income is quite high.
So this 22% rate applies to LLP also.
22% rate does not apply to LLP. It applies only to company. But with LLP, there are some advantages. For example, with LLP, in a private limited company, how can a doctor take money out of the owner of a private limited company? Take money out of a private limited company. It can be in the form of salary, or it can be in the form of dividend, isn't it? When they take money in the form of dividend, that is a share of profit in the company. The dividend received by the individual, that is taken out by the individual, is taxed in the company and also in the hands of the recipient. If they're going to take money in the form of salary, that is also going to be taxed in the hands of the recipient, that is the owner of the company. But if it's going to be an LLP, the advantage is that share of profit distributed by LLP to its partners, that is owners, is not taxed in the hands of the recipient. I think it's getting a little complex, but the share of profit that is getting distributed by the LLP to the partners is tax-free in the hands of the recipient of money. That is tax-free in the hands of the partner. So that's a significant advantage of the LLP. So long as the income does not exceed some 50-60 lakhs, it makes a lot of sense to form an LLP and run it. But if it exceeds that, then it's better to go for private limited. There is one more reason why one should go for private limited, which is that Dr. Sindhu will be aware of that when you go for venture capital investments or private equity investments, the way, let's say, Kaveri Hospital has done, it's important to have a private limited company rather than having a proprietary LLP.
The second question is basically, there was an article in Economic Times, I think Economic Times is one of their business newspaper, which said that the returns on FD and PPF is more than the mutual fund and equity investments in the last 5 years. So, but now there is a lot of shift towards the mutual fund investment, but because the FD rates have come down, so people are concerned whether we should still keep the money in an FD.
Yeah. So
the last 5 years, this article said last 5 years, the FD, I think they're comparing it with the low point which has reached the returns on the mutual fund.
So I can show some slide and explain to you, but in the interest of time, it's like this. Let's say you are running a hospital. You have seen times last 10, 20, 30 years, how industries, how your practice has transformed, how you have been growing, right? But during this period of COVID, you've not been making money. Any doctor would not have, any hospital would have, lost a lot of money. They would not have made enough money, isn't it? But does that mean that my income is stopping, or does it mean that it's all come to an end? Certainly not, isn't it? It's going to pick up. Likewise, it's very important to understand that a financial asset such as a mutual fund or equity, it's riding on the success of businesses. Now, in businesses, there will be times of fantastic growth, and there will be times of lower growth, and there will be times of stagnation, right? So, when we go through periods of stagnation, the income during that period is lesser, but does not mean that income is going to be stopping there. So that's not the point. We need to understand that if you go through this period, then whatever returns that this can deliver, no other asset class can deliver. So you need to stick to those asset classes. But important, again, there's one underlying point that we need to know where we are investing, right? If you're going to be investing in the wrong set of investments, you need to have a proper advisor in place when you go with financial investments. And that advisor should be advising you not from his interest, right? It's like a doctor advising medicines for his own personal interest. He's going to be, should be advising, as you all do. You are going to be advising medicines only in the best interest of the patient, right? So as long as you are being advised the right solution, absolutely you can stick on to that, and that's the best way to make money. I can tell you from my own personal experience, I've been investing from last 2000. I invested in properties, equities, mutual funds, bonds, debentures, everywhere. No better asset class that can deliver more than 12-13% than equities. Of course, bonds can deliver without risk around 10% interest rates.
So one more question, I think it is to Mr. Ananthapadhmanabhan, sir. Basically, it is about, sir, NABH specifically wants manual data recording. So can a smart hospital get accreditation when you don't have the manual data recording? So that's, I'm not very sure about this.
No, I think I should clarify this. They want a record. We can always get a PDF file downloaded and show it to them. It is still in the recorded form.
Okay, so basically from the software, you download a PDF form and show it to them.
Give it to them. Yeah.
That is acceptable by NABH.
It's acceptable. They want it in writing. It's there.
Yeah. And
can I add something here? I
yes,
have dealt with hospitals who have got NABH certification, who are also going for NABH certification. So any form of accounting that is in compliance with accounting standards prescribed by Institute of Chartered Accountants of India, or rather the income tax authorities, is acceptable to authorities, NABH authorities. So long as it can be Tally, it can be QuickBooks, it can be several other softwares. You should be able to download it and present in a good format.
Yeah, Dr. Sendil, when telemedicine can happen now, when it has been legalized, I think, tell me why you should not have readings of temperature in the digital form.
Yeah. So the other question is to Thulasi Raj, sir. Sir, it's from Dr. Wasim Gori from Mumbai. He is the Executive Director of Healthcare Indian Economic Trade Organization. So, sir, please elaborate on the role of remote patient monitoring and chronic disease management ecosystem in the post-COVID era. So, he wants to know more about remote patient monitoring in the post-COVID era. Maybe we can even apply it to ophthalmology. Yes, I will. I think you're, so 1 minute, you're muted. Just give me 1 minute, sir.
Yeah.
Yes, sir, you can speak now. Yeah.
Yes, so like I mentioned earlier in my talk, I think technologies also have to evolve. For chronic cases, I think today what may be more practical in the immediate model is if the patient can go into some local center where they have certain technology which can do that monitoring. Like in ophthalmology, it could be a vision center, wherein we can do intraocular pressures, do fundus imaging or photography. So I think today we need to have the patient access some of these technologies, because I think that evolving to the home level may take some more time. Like I know that there are people like neurosynoptics and few others who are developing a lot of technology which can be used at a village level. Using a tablet, to do an ECG or an ultrasound, all of that is happening. So some of us will probably wait for market to mature, but if all of us wait, market will never mature. I think some of us will have to start venturing out to push the boundaries, to kind of do whatever is possible. Like in our case, we are now able to monitor, for example, diabetic retinopathy, which is a chronic condition because this doctor also is a diabetician, I think. And it's basically done by placing a fundus camera in each vision center, which is a primary care center located in villages, covering about 50-60,000 population. And so today, so can the patient do their own fundus imaging? So that will take some time, and we don't know how the technology will mature or how the market will react to that. So that would be my advice for the immediate. I think we can certainly do what Sendil called as a B2B model. Have the patient go to an intermediate center where the technology is available.
Now, one more question from Dr. Bhartiya is I think he is asking, is the Aravind software available for other eye hospitals?
Yeah, I kind of responded privately saying the answer is yes. I think Aravind by philosophy is an open source organization. So whatever we develop is accessible, available to everyone. Some of them for free, some of them for cost, if there's a cost involved. Yeah. So the time frame may be 5-6 months from now.
Another question to Mr. Dr. Ananthapadhmanabhan. So IoT for 30-bed hospitals, possibilities. I think he is asking what is going to be the cost, and I think maybe the question is something like that. IoT for 30-bed hospitals, what are the possibilities?
Yeah, IoT for 30-bedded hospitals are possible. Maybe you should choose some modules like energy monitoring, water supply, maybe even the employee monitoring, maybe something on consumables, monitoring consumables through RFID. I think it is possible and it is very cost effective, and we can implement it, can pay back in a matter of about 2 years.
I think Mr. Samuel Dhanasingh, he is your student, he has a question.
Yes.
I will unmute him. Yes, sir. Mr. Samuel,
please go ahead, Sam. Please go ahead.
You are unmuted. You can actually ask the question.
Good evening, people. I'm Samuel. So, like moving towards digitalization, like people like you all know the fear of cyber attacks. You may know about the cyber attacks in NHS. British is well advanced in hospitals, IT infrastructure. Still, yet they were attacked by ransomwares. And like I've too worked with a lot of hospitals in Chennai, and I myself have seen a lot of hospitals, especially small hospitals, are unaware that many of their networks were infiltrated with malwares and recycler viruses. So I think we need a lot of education in cybersecurity. Like, we get audited by NABH, like some JCI, but we are not taking security audits very wisely, because as more of us are moving towards...
Sam, can I answer your question? And I got your point. The point you're trying to make is that security is a very important issue in, especially in systems like IoT and maybe entire healthcare scene. But what you must understand is now a lot of security methods are available. You can encrypt data. You can give limited access to people. You can create different layers of security in the hospital, then maybe in the cloud. Then you have edge computing. So I think it is like this. You cannot stop the rain, but you can always carry an umbrella to protect yourself. So I think just because rain is there, you can't say I won't go out in the rain. you have to go out in the rain, but you must have enough protection using an umbrella. And I think now a lot of cyber security experts are available, and they let you know, but only, as you rightly said, I think a lot of education needs to be done to the users. A lot of education needs to be done to the users, and the people who are using IoT solutions and even solutions like AI and artificial intelligence, I mean AI and ML and all that, they should really consult cybersecurity experts and then take appropriate measures to guard the business against cyber attacks and hacking. Yeah, is that answers your question?
Yeah. Yeah, it fairly, so replying to Gopal Bajaj. Okay. Yeah, I think there are no more questions. If nobody else has question, we are already running around 45 minutes late. I would like to thank all the speakers and Dr. Panniselvam. So I would like to invite Dr. Panniselvam sir to come and give the vote of thanks for the meeting. Apologies for the technical difficulties. I think we are also learning. So hopefully next meeting we'll be able to do it better.
Thank you, Dr. Sindhu. Thank you very much for moderating and be a very great help to me throughout this journey. This is my first webinar hosting, and even digitization, I have to learn a lot to make it work for the conference. But it was a very nice learning, and we learned a lot from the speakers, Mr.R.D.Thulasi Mr.Thulasi Raj and Mr. Siva Ramakrishnan. It was a great learning for us. And I was really thankful to all the participants for overwhelming response. But due to some reason, we were not able to accommodate all the participants who wanted to come in, and we'll be keeping in touch with them. These presentations have been recorded and we'll send to each and every participant who have registered for this. Thank you very much, and then hope to meet you all again once more without any glitches. Thank you all. Thank you once again, all the participants and the speakers. Thank you from Erode CII. Thank you, sir.
Thank you. Thank you. Thank you. Thank you.